Bismillahirrahmanirrahim. Honorable speakers, respected faculty members, and my dear students, Assalamu alaikum. Today, it's very a matter of pleasure for me that we are starting our first webinar from Institute of Pharmacy. In this case, I am very much thankful, especially to my colleague, Dr. Arham and Dr. Ali, who organized it within very short period of time. In the same way, I am very much thankful to my speakers who gave their precious time to utter certain words for our pharmacist colleagues and students. Dear students, the Institute of Pharmacy was developed as a Department of Pharmacy in 2003 when this university was first got the status of university in 2002. The first batch was passed out in 2008, and afterwards, this journey keep on going and on. We also started specialization disciplines in pharmacology, pharmaceutics, and pharmacy practice. Presently, 300 and around 50 students passed out, are studying in the Institute of Pharmacy, and 70 students passed out every year from the Institute of Pharmacy. It's a great privilege for me and an honor for me that the presently Vice Chancellor, Professor Dr. Bushra Mirza, gave this department, who was firstly transformed into institute. Now it is working under the Faculty of Pharmaceutical and Allied Health Sciences. And the credit definitely goes to the Vice Chancellor, who always encouraged pharmacists and the Pharmacy Institute. Likewise, I'm very much thankful to the faculty members who always stood by me. I'm also very much thankful to my students who worked hard day and night, and wherever they are, they support the pharmacy profession and they participated in the pharmacy profession with their whole strength and with their zeal and zest. I also want to tell you one thing, that every year the graduate pharmacists appear in the Public Service Commission, and almost from Lahore College, they gain the seats of 5 to 10 among all the Public Service Commission appeared candidates. Our students are working very well, not only within the institute, but outside the institute as a professional pharmacist. We are the institute who started very firstly clinical pharmacy projects. We are the first one who started very firstly industrial pharmacy projects. Our students are also very active in the social subject projects, like as an active citizen program. Our students are very much active with the Director Student Affairs and participating their role in university in managing different disciplinary duties. Our faculty is very prominent in getting many types of trainings, many types of lectures, and they organize these lectures and trainings off and on. I am very much thankful to my Vice Chancellor, who gave her precious time, in spite of this thing that today is the Kashmir Solidarity Day. She extracted some time from her precious time to deliver certain words about it. Now I would like to share the screen with Dr. Arham to start the whole this webinar in the name of Allah. And after that, we will start the message of the Vice Chancellor for all of you. So please, Dr. Arham, recite in name of Allah and start the webinar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله أفواجا فسبح بحمد ربك واستغفر إنه كان توابا صدق الله العظيم.
Dear colleagues, very honorable speakers, now the address of the Vice Chancellor starts now. Please share.
Assalamu alaikum. It gives me immense pleasure to welcome you all to this webinar on role of pharmacists in COVID-19. Pharmacists are integral part of our healthcare system. They have always been playing very vital role as hospital pharmacists, clinical pharmacists, community pharmacists, and industrial pharmacists. In COVID-19 also, we saw them working in front line to provide healthcare to the community. Pharmacy department of Lahore College for Women University has produced some very fine pharmacists who are playing their vital role in different fields of pharmacy in the community. During COVID-19 also, we saw our pharmacy department playing a very active role in developing SOPs and their implementation in the campus. They also produced hand sanitizer, which was distributed among the staff and students of the campus. It was also presented to the Chancellor, who highly appreciated the role of our pharmacy department. I congratulate the director and her team for organizing this seminar, and I am especially thankful to the resource person, Mr. Shoaib Khan, Mr. Usman Nawaz, Mr. Sardar Shabir Ahmed, and Mr. Kalimullah, who have extensive experience in the field of pharmacy. I'm sure their presence in this webinar, in which they will share their experience with our students, will be of immense help to our students. It will provide them the knowledge they need to be active pharmacists in their life. I again congratulate our pharmacy department and wish all of you very productive time during this webinar. Thank you.
Thank you very much, Mrs. Saiba. Now I will invite Mr. Sardar Shabir Ahmed, who is serving as the, I would like to invite Mr. Mr. Mohammad Shoaib Khan, who is currently serving as Superintendent Pharmacist in Cockerton Pharmacy, UK. Sir, we invite you and we welcome you on this webinar from whole of the faculty. So please start your speak. I just want to share with my colleagues and my students, if you need any question, if you need certain query, please raise your hand. We will put it down at the end of the session, at the end of the talk of the person, we will invite your questions. You may also written your questions in the chat and send us. Thank you very much.
Assalamu alaikum. Ji Shoaib sir, please continue.
Right. Okay. As you all are aware that we are discussing about the role of the pharmacist during this pandemic. First of all, I would like to say thanks to all Dr. Shabir and Madam who has introduced myself and the Vice Chancellor of the university. Thank you very much, all of you. And yeah, now before getting into the discussion about the role of pharmacists during the pandemic, I just wanted to go a little bit into the background of this whole situation when we were getting into the lockdown, right? So I just want to go back into March 2020, when you might be aware that each and every government throughout the world, throughout the globe, they were really confused what they're going to do, whether they're going to do for, whether they are going for the lockdown or they are going for the herd immunity. So eventually, almost every government, every country throughout the globe, they decided to go for the lockdown. And that was the time when our role was started. That was the time when people started recognizing pharmacists. So the role of the pharmacist during pandemic is something that could be recognized at that time when we take it back into March 2020, because we were the only profession at that time, especially when we talk about this country of UK, we were the only profession. We were the main healthcare workers who were open throughout that time. The GP surgeries, they closed their doors. Doctors were, almost throughout the country, they were not open. They haven't had clear access to the public. And most of the consultants, they were not giving the services at the time, because quite a lot of services, they were directed towards A&E, which is called accident and emergency, because of this COVID-19. So when the government decided to go for the lockdown, people started coming towards us, and people were relying heavily on us. They were relying whether they can get their medicine, because in this country, you might be aware of this thing, that medicines are divided in 3 different sections: POM, P, GSL, where POM stands for prescription-only medicines. And when we talk about people, when they're worried about their prescriptions, about their medicine, because obviously GP has to prescribe, and the prescription comes into the pharmacy, and once it's been dispensed, then the pharmacist check, and then pharmacists hand out those prescriptions. Those medicines, obviously, once they have checked the prescriptions. So in that case, people were really panicking. They were not sure what to do, and they were asking so many questions. Where they're going to stand in case of this lockdown, in case of this pandemic. So we were just keeping the whole situation calm, and we were saying that everything would be ready for you. And we really did hard to make everything ready at that time for the people, and also for the member of public. They were raising so many queries regarding some minor ailments, like minor ailments mean like some normal skin conditions, cough and cold conditions, fever. They were asking what to do in case of in case if they catch COVID, like if they had any cough, cold, and if they have got any sort of fever, headache. So we were giving them every possible advice at that time. And the time was very difficult for us as well, because people were just rushing into the pharmacies. As I mentioned, that everywhere most of the GPs were closed. Almost, I can say, every GP surgery was closed, and they had no clue what to do. The second point was the availability of the pharmacist, the pharmacy team, the staff, the stock, the medicines. That was quite important as well, because we were struggling with some common medicines like paracetamol. We had a shortage of that. So, we started, advising our customers what to do, how many they need to take. And obviously, like in case of this, when we noticed that they were stockpiling those medicines, so we had to stop them. We had to advise them that you don't need this much. You just need to keep this much of a stock, and that's it. And the other point was, obviously, when we talk about minor ailment, there were so many things they were asking. And prior to that, they were never asking the pharmacy or pharmacist about those conditions, about those minor ailments. But we were the one who were giving them advice regarding any type of ailment, like cough, cold, if their child had any problem, if they had any problem, about the stomach condition, about the throat condition. So we were giving them every possible advice at that time. The third main point at that time that came to us was delivery. Obviously, when the rest of the places were closed, and some people were sent a letter from the government that they were supposed to be shielding. Shielding means that, people who were either above 60 or 65, there were certain age limits in this country, and people who had certain underlying conditions, they were advised by the government that they are not supposed to go out, they need to stay at home. So we were the one who were making deliveries to them. and that was quite helpful for them. And we were even, we were always giving them a ring before the delivery and advising them what to do and what the driver going to do. And you need to stay at home, or you need to be vigilant at the time when the driver is at doors. So obviously, we did the delivery service for our customers, for our patients, and especially for the patients who were shielding at that time. The other main point was engaging with the customers and with the patients and with the doctors. Engaging them in terms when we had any sort of shortage, when we had any sort of problem related to their prescription. So we were trying to help them out. You might be aware of this thing that, all around the globe, there were shortage of medicines. There were, like some delivery services were not functioning properly. So we had a very common medicine that was called sertraline antidepressant that we had a shortage of. So we were just dealing with the GP surgeries that if they can prescribe any sort of alternative, or if they can give different strength, so we can ask them to take half of it. So we were dealing with, every possible situation that was coming to us, because obviously this COVID was coming very fast, especially after March 2020. So when we talk about how the pharmacy profession was different from the rest of the profession, rest of healthcare profession, so we were different in the sense that we were open throughout, and people had a proper access to the pharmacist and the pharmacy team. And that created a very good impact among the public. And also, when we talk about prior or pre-COVID time, our services were not recognized as much, but after that they were really recognized, because people knew only two words, like whether doctors or nurses, or sometimes paramedics, but they were never aware of this thing that pharmacists can give all those services, like they can be a part of this healthcare system. So eventually, the Prime Minister of UK, he came on the telly, Mr. Boris Johnson, he came on the telly and he addressed the nation, and he appreciated our services. As he knew this thing that people were really relying on us, and we had to be on top of their expectations. So, the major problem that we were having at that time was obviously the influx, the footfall that was coming into the pharmacies, and we had to manage them. And we obviously, because not everybody was allowed straight away to come into the pharmacy, because we had some sort of social distancing as well. So there were quite a lot of things that we were focusing on, but the major issue that we were having at the time was obviously like how to deal the lockdown situation, and how we're going to do with people who were above 60 or above 70. Obviously they were not coming out. So we dealt with that situation, and it all went really well, to be honest. But obviously, we really appreciated our pharmacy team and each and every pharmacist who was working within the community. Because there were a few things that were totally different that we were doing in terms of delivery, in terms of managing their prescriptions, in terms of managing their ailments, in terms of giving them advice at the right time. And this thing has really helped them, and people really appreciate it. And you would be surprised to know that there were so many people who came after this lockdown, and they were sending us thank you cards, and they were sending us thank you messages, and they have really appreciated throughout. So I would say in this case that our role has been recognized throughout the world, and especially when we talk about this country, and especially in any country, where people, prior to that, where people were not aware, then they became really happy, and they are really thankful that pharmacists have done a very good job. So that's all from my side. If there's any question, please do not hesitate to ask.
Thank you very much, Shoaib Saab. It was very nice talk. It was good to know the appreciation from the public at large, and the acknowledgement from the Prime Minister of the UK. We certainly know that you people there in the UK and around the world, all the pharmacists are doing very good job. So very well done. I'm thankful to you for your talk. Now I would request Mr. Usman Nawaz to please share his views with us. Usman, can you listen to me, please? Can you hear me?
Assalamu alaikum.
Well,
First, please allow me to introduce Usman to you. Usman is a dear friend of mine. He is PharmD from Faculty of Pharmacy, Islamic University, Bahawalpur. And then he did his MBA from Pakistan. And then he is registered with Saudi Commission for Health Specialist. He is also board certified pharmacotherapy specialist from Board of Pharmacy Specialties, USA. He has also received certificate of antimicrobial stewardship, and he is a member of American Society of Health System Pharmacists, a fellow of American College of Clinical Pharmacy, and a fellow of Society of Infectious Disease Pharmacists. Currently, he is serving as a team leader and hospital pharmacist in King Abdul Aziz Medical City, National Guard Health Affairs, Saudi Arabia. I welcome Usman to you. So please start your talk.
Thank you, Dr. Aram, for introducing, and thank you, Lahore College for Women University, for arranging this webinar. And as we are discussing today about the COVID-19, what
Excuse me, Dr. Usman, zara please thoda sa a bit aloud.
As we know that we will discuss today about the COVID-19, pharmacist's role in the COVID-19, and I will just add some things based on the pharmacotherapy point of view, that what a pharmacist should know about how to treat some patient with the COVID-19. If there is some consideration about the pharmacotherapy point of view, so all pharmacists should have some basic ideology that what are the current guidelines and what are the things. So my voice is okay now, or still it needs to be louder? It's okay now?
जी डॉक्टर साहब ठीक है बिल्कुल.
Okay, so I will start with my presentation. Let me share my screen here. I think this is disabled by the host. There is no need to share the screen.
साहब please screen share कर दें उस्मान साहब की.
Yeah, still there is a need permission from the host.
Let me talk to the host. जी स्क्रीन शेयर हो गई है उस्मान.
Okay.
You can continue.
So in my presentation, we will discuss a little about the pharmacist's role in COVID-19 and what pharmacists can participate in the community level for the awareness of the people. For my presentation, I have no conflict of interest to disclose. And in my presentation, we will discuss the infection prevention and control during healthcare when COVID-19 is suspected. Then we also discuss about the clinical presentation of COVID-19, risk factor of severe illness. Then we will also elaborate clinical management and treatment of COVID-19 according to CDC and IDSA guidelines. And we will also discuss some practical experience that we have in Saudi Arabia. We also describe about the COVID-19 guidelines, consideration for pharmacies during COVID-19, and ASHP checklist for pharmacies and pharmacy technicians. And we'll discuss the role of pharmacists for preparing essential medication lists for their institute or their country or their community that will be very helpful for their COVID-19 pandemic. And we'll also discuss some practical strategies in which being as a pharmacist, we can play our role to minimize the burden in the healthcare settings like in hospitals, primary health units, or in pharmacies as well. Let's start with brief introduction of the COVID-19. COVID-19 is, as everyone knows, that is one of the 2019 novel coronavirus from the family of the coronaviruses. It was first time notified in China in December 2019. Until yesterday, there are about 19 million cases of COVID-19 worldwide. And among these 19 million cases, 11.7 million cases are recovered. And still, we have 6.6 million active cases of COVID-19 worldwide. And unfortunately, until now, there are around 0.7 million deaths by this virus. COVID-19 is spread by, like other respiratory viruses, by coughing, sneezing, by personal contacts, and touching with the contaminated surfaces. In March 2020, WHO released the interim guideline how to protect the healthcare setting from this virus and how can we prevent the spreading of disease. And there are time to time there are updates from this interim guidelines, but most of the countries we are following these interim guidelines to control this pandemic worldwide. In this interim guidelines, I will just discuss the main points. They are like ensure triage, early recognition, and source control. These apply standard precaution for all patients. There should be implementation of empiric additional precaution, and there must be implementation of administrative controls by the healthcare authorities, and there must be some environmental engineering control in healthcare setting to protect their employees from getting this disease. On April 2020, CDC issued a recommendation that the general public, even those without symptoms, should be being wearing face covering in public settings where social distancing measures are difficult to maintain in order to abate the spread of COVID-19. So worldwide, we are all are following this protocol, and this is the one of the main thing we are considering that is helping in controlling this deadly virus. In the same day, in April 2020, CDC also released a publication that there is no recommendation for use of chloroquine and hydroxychloroquine as a prophylaxis. The incubation period of this virus is from 14 days, from 11 to 14 days, but normally symptoms appear in the body in 4 to 5 days. All the patients with this disease normally appear with following symptoms like fever, cough, fatigue, anorexia, runny nose, shortness of breath, sputum production, and myalgias. There are some risk factors for severe illness of this virus. And among the risk factor, age is the main factor. Then the cardiovascular disease is another risk factor. Prayer, stroke, diabetes, chronic respiratory disease, cancer, and CKD, chronic kidney disease, also are a contributing factor by the severe illness by this COVID-19. There are many hypotheses and there are many rumors around when this virus was introduced in the world. Some are saying that we cannot take the answer. Some are saying that because of this virus nature that it enter in the body by the ACE2 receptors, so we should not take the ACE inhibitors or ARBs. But until the 30th July 2020, according to American Heart Association, Heart Failure Society of America, and American College of Cardiology, they released a statement that there is no link between the use of ARBs and ACEs and the severity of the COVID-19. So those patients who are taking these medication, ACE inhibitors or ARBs, they can still continue using their medication without any further deterioration. Regarding the NSAIDs used during the COVID-19, initially there was thinking that we should not use the NSAID who are suffering with the COVID-19, but still there is no clear data that NSAID can further worsen the COVID-19 symptoms. So people who are in need of NSAID, they can use NSAID during COVID-19. From the start of this virus worldwide, is vaccination against COVID-19 is a big question. Everybody is considering about vaccination and when we will receive, but worldwide until now there is no clear-cut guidelines when we will receive this any vaccine against the COVID-19. But according to many organizations, most likely we will receive the first vaccination publicly available between 12 to 18 months from the date of January 2020, because in January 2020 the genetic sequencing of this virus was published, worldwide. So most likely by the end of this year or by the mid of the year, it is expected that we will receive our vaccine against the COVID-19. Until now, the worldwide there are 202 vaccinations are in development against COVID-19, and among these 202 vaccines, there are 24 vaccines. Those are in clinical trials. I will just discuss the leading candidates who are in the race of producing these COVID-19 vaccines. There is one vaccine. There are 5 vaccines. Those are in phase 3 trial. Uh, among the AstraZeneca, Sinopharm from China, Wuhan, and Beijing, and Sinovac and Moderna. These 5 leading candidates have their vaccination against COVID-19. Those already in the phase 3 clinical trial. Rest we have some vaccines for the phase 2 clinical trials and then phase 1 and phase 2 as well. Because most likely the proceeding in the development of the vaccination is with good news. In the start, there is also big myths again, the convalescent plasma for the possible treatment of the COVID-19. And because of this lack of knowledge, there was a great misuse of this treatment for the COVID-19, and people were start selling their plasma, and there are many wrong practices that ultimately cause the harm to the patient, because when we are not using anything and there is no clear clinical trials that can ultimately end with the harm for the patients. So for the convalescent plasma, there are many myths, but until now, all the authorities, including the US FDA and National Institute of Health, they are saying that there is no established references that can show that convalescent plasma can help any patient. Also, the Surviving Sepsis campaign of the COVID-19 subcommittee suggests that convalescent plasma should not be used routinely in critically ill adults with COVID-19 because efficacy and safety not established, and uncertainty surrounding optimal preparation of convalescent plasma is also a questionable. Because of all the bad result by the use of this plasma in patients, FDA end up with a consensus until now that all the patients who need this plasma for their treatment, they must be in following these 3 categories. Either we will use this plasma for the clinical trial purpose, or we can use this plasma as a expanded access program, or we can use as a plasma as a single patient emergency. And FDA develop a certain criteria for those who can receive this plasma, not all the patients. They develop a eligibility criteria for recipient of this plasma. These patients should have one or more of the following, like shortness of breath, respiratory rate more than 35 minutes, his oxygen saturation less than 93%, and his oxygen and FiO2 ratio less than 300, and his lung filtrates should be greater than 50%. And he has life-threatening disease like respiratory failure, septic shock, or multi-organ or any other organ failure. Spectrum of illness or severity of COVID-19 patient we can categorize in mild to moderate symptoms, with patient with severe disease, and patient with critical disease. Mild to moderate disease, most of the patients who are asymptomatic, they can treat at home, who has no need for the oxygen. They can, if they follow the proper isolation protocol and just by the sporting treatment, they can treat at home. But for the patient with critical disease or severe symptoms, they need to be hospitalized in the hospitalized. Time to time, IDSA worldwide, they introduce the recommendation for the treatment of COVID-19 patient. And with the passage of time, there are many improvements, and we have many new protocols that can help COVID-19 patient. And with the passage of time, there are many practices are under control, those can harm the patients. There are many recommendations. Among the recommendations, like initially many people start taking the chloroquine and hydroxychloroquine as a prophylaxis worldwide because there are lack of knowledge So the IDSA released a recommendation that there is no use of the hydroxychloroquine and chloroquine, and only we can use this medication in the clinical trial context. In another recommendation, there with the hydroxychloroquine plus azithromycin, we can use in hospitalized patient out of the clinical trial context. Then they also introduced lopinavir, ritonavir for patients with the COVID-19, and then there is also guidelines for the use of the steroids in COVID-19 patients, and then there is also a guideline for the patient with the who have the cytokinin syndrome. In those patients, we can use tocilizumab, but still the tocilizumab used worldwide is under only the supervision of the clinical trial or by the proper approval by the US FDA. Among patients who have been admitted to the hospital with COVID-19, IDSA guideline panel recommend COVID-19 convalescent plasma only in the context of clinical trial only. So after the US FDA, IDSA also released their recommendation that we can use plasma only in clinical trial settings. Then there is also introduction of the remdesivir and use of remdesivir in patient with ventilation or need of ventilation, mechanical ventilation or ECMO. Now we will come towards the management of the COVID-19. There is time to time guidelines for the PPE used worldwide for the suspected and the confirmed cases of COVID-19, and we should use these protocols to protect our healthcare. Mainly, this is for the protection of the healthcare peoples, so that if more people will get the disease, it will be hard to run the healthcare system. So there is a proper guidelines now that when we will use the PPE, like if it's suspected cases, then we should have to use a surgical mask, goggles with face shield, and when any healthcare staff is going towards the nasal swab, there must be head cover and the disposable gloves. And patient for the treatment with the confirmed cases, there is a worldwide recommendation that the healthcare staff must wear the N95 respirator, the goggles, the disposable gloves, and head cover. There are guidelines that they must for the clearance of the suspected and confirmed cases. PCR negative result of COVID-19 and clinical improvement, no fever 48 days, and no other reason for the isolation, then we can release this patient to discharge from house. Patient with the confirmed cases, there must be 2 negative results within 72 hours and 1 after the 24 hours. We can categorize patient with clinical syndrome associated with the COVID-19 definition. Patient can have the upper respiratory tract infection. They can suffer with a pneumonia, severe pneumonia, and acute respiratory distress syndrome. Now we'll just discuss something about the recent pharmacotherapy for the COVID-19. Those patients who are asymptomatic, as per the IPC guidelines and IDSA guidelines, there's no need for the treatment, and we can only treat those patients by the supportive care. Those patients who has mild to moderate symptoms, but they don't have any pneumonia or they don't need any oxygen, supplemental oxygen. For those patients, we can consider any of the following treatment. There is recently treatment in the clinical trials, triple combination therapy for lopinavir, ritonavir, ribavirin, and interferon. And or we can consider the patient for giving favipiravir is recently added in the FDA list in July 30, and we can also, if the third option is the use of the hydroxychloroquine at the usual dose, 400 milligram BID for day one, and then 200 milligram BID for next 5 to 7 days. If hydroxychloroquine is not available, then we can consider chloroquine. Those patients who has severe symptoms, in patient with severe symptoms like his respiratory rate is more than 30 in adults or more than 40 in children's, oxygen saturation is less than 93, and lung filtrates are more than 50% within 24 to 48 hours. Then in these patients, we can also consider the same treatments as we discussed earlier in the mild to moderate symptoms. But in these patients, we can consider the use of steroids as per the recent guidelines by the IDSA. In critically ill patient, now we have a number of options we can use in COVID-19 patient. We can try the remdesivir. If the patient is on mechanical ventilation, we can use it for 10 days, and if the patient has no mechanical ventilation, then we can use remdesivir for 5 days. Recently, for critical ill patient, especially with the ARDs, we can use favipiravir. Steroids are also recommended now for all patients with the ARDS. And if patient has a cytokine release syndrome, in those patients we can consider the use of the tocilizumab. Before using the tocilizumab, we should have to check the IL-6 level of the patient. We should have to rule out the latent TB and high risk infection and benefit outweigh the risk. I will just discuss one of our recent case in our hospital. And that patient is a 73-year-old female with diabetes mellitus, hypertension, PE, hypothyroidism, and this patient got positive with COVID-19 after the proper diagnosis. And after the chest X-ray, it reveals that this patient has the acute respiratory distress syndrome, and we admit that patient to ICU, and that patient required mechanical ventilation. After ICU administration, we incubate the patient for tachypnea, respiratory distress, and alkalosis, and it was difficult to incubate due to the vocal cord edema. We implement the strict isolation protocol. We start azithromycin 500 milligram IV for 3 days, then start hydroxychloroquine 400 milligram BID for day 1 and 200 milligram. Also start for empiric treatment for the pneumonia, ceftriaxone, hydrocortisone, and sedate the patient. Keep the magnesium level more than 1 millimole and potassium more than 4 millimole per liter. Start the DVD prophylaxis as per the recent guidelines, and start the NGT feeding. After the 10-day stage, the patient was able to respond back well, and we exclude the patient and stop his antibiotics and hydroxychloroquine after the course of 10 days, and taper down hydrocortisone as per the protocol. Shift the patient from ICU to the normal ward, and next COVID-19 test to be done on 2 days after the discharge from the ICU to the normal ward, and ultimately patient was living healthy life, and we discharged the patient successfully. Still the patient is okay, and there is no more complication by the COVID-19 with this patient. Now we'll come towards the role of pharmacist during the COVID-19. Pharmacy as a vital part of the healthcare system. Pharmacists play an important role in providing medicines, therapeutics, vaccines, and critical health system in the public. Being as a pharmacist, we should have to ensure continuous function of the pharmacist during the COVID-19 pandemic, as this is integral and very important for everyone to receive the medication without discontinuation. During the pandemic, pharmacy staff can minimize their exposure to COVID-19 and reduce the risk for customer by using the principle of infection prevention and control and social distancing. In the pharmacy, we should have to make sure that pharmacy staff who have fever or respiratory symptoms stay at home and away from the workplace until they have recovered. Ensure that sick leave policies are flexible, non-punitive, and consistent with public health guidelines, and that employees are aware of and understand these policies. Filling of the prescription. Although the actual process of preparing medication or dispensing is not a direct patient care activity, the other component of medication dispensing, such as prescription intake, patient counseling, patient communication, may expose pharmacy staff to individuals who may have respiratory illness. So we can save our staff by providing proper hand sanitization and educate our healthcare worker how to protect themselves, and providing the proper protective equipment to them. We can implement some strategies in which we can help our staff from exposing to the respiratory ill patients. We can use the proper engineering controls, we can use administrative control, and the use of the proper protective equipment. It is now mandatory that all clinical settings should wear a mask when within 6 feet when within 6 feet of another person or in public space, hallway, criteria, or lobby. Members of healthcare teams should minimize exposure risk by encouraging the completion of tasks or participation in the meeting virtually. Pharmacists can also play a vital role by maintaining the adequate stock of the critical medications, because some medications are very critical for COVID-19 patient, and this is the core responsibility of the pharmacy and therapeutic committee, particularly in hospitals and community settings, that we should have adequate stock during this pandemic. So there are many protocols now in which we can follow to maintain our stocks. And if they use some medication, those are critically needed for the COVID-19 patient, we can segregate the particular portion of those medication for our pandemic patients. Pharmacists can also play a vital role in making essential medication lists for their institution, for their country, and their community. WHO introduced time to time with the updates in the selection and use of the essential medication, and they update the essential medication list time to time. So if pharmacists are working in hospital settings, or they are working in with the government or other healthcare sectors, they can use this essential medication list to update their own formulary or community medication essential list, and make an adequate stock of their medications. Being as a pharmacist, we should know that the strategies, and we should implement those strategies, that how can we reduce the workload of patients in our healthcare settings. Like in our hospital, we implement the policy of the virtual clinics. We introduce electronic medication refill systems, and we send our all refills to the patient by couriers. We also implement the blood sampling from the home. We also introduce mobile health units to reduce the burden of patient in our hospital. And we also make a special consideration for the oncology patient, because oncology patients are at more verge of getting infections, because they are already immunocompromised because of their chemotherapy or other and disease illness. So for our oncology patient, we introduced many guidelines and protocols in which we use their less frequency chemotherapy protocols. We try to change IV chemo to oral chemos. We also introduce virtual anticoagulation clinic for all our oncology patients. And for their anticoagulation profiles, we also introduce the blood sampling from their home. So there are some measures by which we can, being as a pharmacist, we can help our community and reduce the burden on healthcare systems. It's all about my presentation. Thank you for your participation, and my acknowledgement for the Dr. Shabir for arranging this webinar, and also thanks for Lahore Qualified Women University for giving us opportunity to speak over here. Thank you.
Thank you very much, Muhammad Usman. I want to know something about convalescent plasma. There is a question in my mind. What is the prerequisite for the patient, for the recovered patient who can donate the convalescent plasma?
Actually, FDA introduced the titer.
There are certain protocols for the people who can donate the convalescent plasma, or there is no protocol, there is no restriction?
There is
give me something about it to our students and to our faculty members. And my question B is, the part of the B is, have you observed certain ADRs among the patients who are receiving these antiviral drugs as well as chloroquine or some other NSAIDs? So please.
This question regarding the convalescent plasma, there are clear interim guidelines, those who can donate this plasma. Not everybody can donate this plasma, because before giving the plasma, we must assure that who is giving the plasma, he has the clear titer of the antibodies that is recommended by the FDA is 1:1.6. If the antibody titer is less than this, then this patient, even if we give his plasma, it will be useless for the patient. So there are the clear guidelines by the FDA. Those can donate the plasma plus those who will receive the plasma. And that's why this is now clear understanding even in our Saudi Arabia. Those who will receive this plasma, we have a protocol and we need to get special permission by the Saudi FDA. They introduce their own website. For example, we need any patient, there is 24/7. We fill the form for the patient, get permission from Saudi FDA, and also notify the result to the patient. Because worldwide, this plasma is for the clinical trial purpose now. Because until now, the harms by this transferring of this plasma is more as compared to the benefits. Regarding your second question, sorry, I was saying what you were asking about the ARDS in patient with.
I asked about the ADRs that you observed in the clinical settings. Any ADRs among these antivirals and the other therapies that are given to the patients with certain comorbidities or simply suffering with the COVID-19?
Actually, depending on patient, if we will just consider about the adverse drug reaction of the medication, there is a chance pain because patient is already vulnerable for getting more problems. That's why those like remdesivir we are considering like or favipiravir. Still, there are different respect for the patients, but right now in our settings, we use it in patients successfully. There is no like non-unique ADRs observed in any patient. The patients are treating successfully with these medications.
And what is the preferred analgesic which you are using in COVID-19?
We are because those who are hospitalized, we prefer to give them paracetamol, and we are giving IV paracetamol. We're trying most of the patients we are trying with this one, but if we need like in more urgent cases, we try to give like narcotic analgesics rather than to give NSAIDs, because still there is conflicting data between the use of the NSAIDs and not use of the NSAID. So we first our preference is the paracetamol. If still need patient like further control the pain, then we use to try to use the morphine narcotic analgesics. But those patients who are in outpatient settings and they need higher analgesia, those patients we can give them diclofenac sodium and celecoxib without fear. They are using very well, no problem.
Thank you very much.
Welcome.
Thank you very much, Usman. It was a very informative talk. I am pleased to know that a patient with the age of 73 and having so much comorbidities, she has recovered in your setting. Having COVID-19, it was a good achievement. Thank you very much. Now I would invite Mr. Sardar Shabir Ahmed. He is B Pharm from University of Peshawar, a gold medalist. He completed his MPhil in pharmacy practice from Hamdard University, Karachi, and he has also done LLB with distinction. He is currently serving as Senior Inspector of Drugs in Islamabad. He is also Secretary Quality Control Board, Islamabad. He is focal person for pharmacovigilance in Islamabad, and he is also the coordinator of the District Infection Prevention and Control Committee, Islamabad. He has vast professional experience in different fields and has served on various designations in previous years. So I invite Mr. Sardar Shabir Ahmed to share his knowledge with our participants. Sir, please.
डॉक्टर अरम मेरी आवाज आ रही है?
जी आ रही है आपकी आवाज.
Okay, thank you very much. Bismillahir Rahmanir Rahim. Respected Vice Chancellor, Professor Dr. O'Mara, the organizers of the event, faculty members, the worthy speakers, and very dear students, Assalamu alaikum and good afternoon. I'm really thankful to Dr. Aram Shabir and other organizers for considering me worth a speaker in this very august forum, although I'm not an expert, but still they have given me an opportunity to speak on the topic, role of pharmacist in COVID-19. With the permission of organizers, I would rather like to extend the topic, a role of pharmacist in COVID-19 in Pakistan. Rather than speaking what the pharmacists have done in USA and UK, I would like to speak what the pharmacists have done or what the pharmacists are supposed to do in Pakistan. We all know that COVID-19, a novel virus, surfaced in China, the Wuhan city, in November 2019. And since then, it showed a very fast spread in the entire globe and has really challenged the healthcare system of almost entire globe, including the developed countries, and has so far affected around 19 million people with 0.7 million deaths. In Pakistan, the figure is 1,82,000, slightly above than that, with 6,000 deaths almost till today. Since the first case of COVID-19 reported in Pakistan on 26 Feb 2020, the government of Pakistan has put in place certain mitigating strategies, which included suspension of flight operations, imposition of social distancing, screening at the point of entries while using thermal guns, then also started the clinical management of COVID-19 patients, home quarantine and isolation activities, then contact tracing, burial procedure for COVID-19 patients. And these activities were further extended on 21st March 2020, when the federal government decided to impose partial lockdown. And during the lockdown activity, the schools and colleges were closed, public transport was restricted, the public hospitals were turned into isolation wards in Pakistan. The working class was advised to carry out their work from home. But there were certain areas which are allowed to operate, and these areas included like utility stores, the grocery stores, the bakeries, and the most important of all these was the pharmacies, which were allowed to operate round the clock in Pakistan. And I think this was the opportunity for the pharmacist to showcase his importance in this entire healthcare system and this pandemic. Now, pharmacist in Pakistan is basically serving in various sectors, but the most important are they are serving in hospitals, and their role as a hospital pharmacist was very, very crucial in this pandemic. Some of the pharmacists in Pakistan are now also serving as community pharmacists. Again, their role is very important as community pharmacist. The pharmacists are serving as regulators, and as a regulator, the pharmacist has also offered very important services in this pandemic. Now, if I talk of the role of pharmacist in hospitals, with the start of pandemic in Pakistan, I think the pharmacists working in public sector hospitals as well as private hospitals, major hospitals, they have started working on contingency plans. The plan to take account of possible future event. With the contingency plan in place, the pharmacist carried out the forecasting of drugs which are required in the COVID situation. They have carried out the risk procurement, actually. And this was very important task, actually, forecasting in a situation when you never know the actual burden of the patients that is expected. The forecasting is a very tricky situation for a pharmacist who is working in hospital. And during a forecasting and procurement process, the most important thing was identification of cost-effective suppliers, because we all know that with identification of the first case in Pakistan, many important personal protective equipments like masks and Tyveks, everything gone missing in the market, and the prices suddenly increased. For example, we all know that a mask in Pakistan in the month of December 2019 was being sold at a rate of 4 rupees per mask. But what we witnessed in the month of March, that the same mask touched the price of 100 rupees per mask. So in such situation, it was very important for the pharmacist who was working in the hospital to identify the suppliers who can provide them these items at a very reasonable price. And the pharmacists have actually done this task in majority of the hospitals, that they have identified the suppliers, they have carried out such procurements, because the ultimate responsibility of the pharmacist who is working in the hospital was to ensure the regular and uninterrupted supply of PPEs and other COVID-related drugs. And they have achieved this target in majority of hospitals. And then again, after making sure that all these items are available in hospital, an important task for the pharmacist was to take control on pilferage issues. Again, this is very unfortunate that जैसे ही चीज़ें शॉर्ट होती हैं मार्केट में, और हम में से हर एक जो है वो ये चाह रहा था कि जी हमें मास्क भी मिले, हमें पीपीईज भी मिले, तो पिलफ्रेज के हॉस्पिटल्स में बहुत ज़्यादा इश्यूज आए, और ये भी एक फार्मासिस्ट के लिए जो है वो एक चैलेंज था. दिस वाज वन ऑफ हिज प्राइम रिस्पांसिबिलिटी टू टेक कंट्रोल ऑफ दिस इशू, इन्वेंटरी कंट्रोल को इफेक्टिवली मैनेज करना, चीज़ों के ऊपर जो है वो चेक रखना. फिर सेकेंडली, रैशनल यूज ऑफ दीज आइटम्स, अगेन अ वेरी इंपॉर्टेंट चैलेंज. हर एक अस्पताल में staff member was willing to use N95 mask. Now to making them realize कि यार N95 already मिल नहीं रहा, जो थोड़े बहुत आपके पास available हैं, they are required for the staff who are in direct contact with the patient. जबकि हमारे यहाँ जो है वॉचमैन भी कहता है जी कि मैंने N95 पहनना है, एक बंदा जिसका वार्ड के साथ डायरेक्ट कोई तलक नहीं है वो भी N95 मांग रहा है. ऐसी सिचुएशन में ये फार्मासिस्ट के लिए बहुत ही चैलेंजिंग जॉब थी कि लोगों को ये कन्विंस करे, और पर्टिकुलरली अपने स्टाफ मेंबर्स को, कोलीग्स को ये कन्विंस करे कि किसको कौन सा आइटम जो है वो यूज़ करना है और किसको क्या रिक्वायरमेंट है और ये नहीं है. और लोग जो है वो वी ऑल नो कि जो हमारी ओवरऑल एक सिचुएशन होती है कि झगड़ने पे आ जाते हैं जी कि क्यों नहीं आप मुझे N95 दे रहे, मुझे आप टाइविक सूट क्यों नहीं दे रहे, वेयर एज कि मुझे पता है कि यार मैंने तो वार्ड में जाना नहीं है लेकिन मैंने टाइविक सूट पहनना है. सो ये भी एक फार्मासिस्ट का एक रोल था हॉस्पिटल्स में कि लोगों को कन्विंस करना, लोगों को गाइड करना कि रैशनल यूज क्या है इन आइटम्स का. हमारे यहाँ फार्मासिस्ट आई प्रैक्टिकली विटनेस्ड इस्लामाबाद में जब मास्क और सैनिटाइजर्स की और पूरे मुल्क में शॉर्टेज हुई, डेफिनेटली वी आल्सो विटनेस द शॉर्टेज ऑफ दीज आइटम्स इन इस्लामाबाद. हमारे कुछ हॉस्पिटल्स में फार्मासिस्टों ने सैनिटाइजर, जैसे अभी वाइस चांसलर साहबा कह रही थी कि आपकी यूनिवर्सिटी में फार्मासिस्ट और फार्मेसी डिपार्टमेंट ने सैनिटाइजर्स खुद जो है वो मैन्युफैक्चर करके या डिस्पेंस करके जो है वो यूज़ करवाए. रियली दिस वाज अ ट्रेमेंडस जॉब. In Islamabad, in majority of hospitals, the pharmacy department, the pharmacists themselves managed to manufacture and dispense the sanitizers. और जब sanitizers कहीं भी नहीं मिल रहे थे तो वहाँ पे उन लोगों ने जो है वो staff को available करवाए. Similarly, one of our pharmacists, mask नहीं मिल रहे थे, they engaged tailors in their hospital. कि tailors को वहाँ पे utilize किया और mask उन्होंने खुद वहाँ पे जो है वो available करवाए उन tailors से बनवा के. और ये मेरे ख्याल में this was sigh of relief for the management. The management and the managers of the hospital were under tremendous pressure by the doctors, by the paramedics कि जी mask क्यों नहीं है, sanitizer क्यों नहीं है. But the pharmacists working over there, they played a tremendous professional role by ensuring the availability of these items. Then came the role of patient counseling and removal of myths. आपको पता है कि हमारे यहाँ फिर जैसे ही सोशल मीडिया पे बड़ी अच्छी चीज़ें भी आ रही होती हैं, साथ बहुत सारी और चीज़ें इंफॉर्मेशन ऐसी आ रही होती है और पब्लिक बड़ी जल्दी जो है, हमारे यहाँ चूँकि लिटरेसी रेट भी ऑल नो तो उस लेवल का नहीं है, तो पब्लिक बड़ी जल्दी चीज़ों पे जो है वो रिलाय करना शुरू कर देती है. एंड आई विल कोट वन एग्जांपल. जैसे कोरोना का ये सिचुएशन शुरू हुई, सना मक्की का रोल, ब्लाइंडली लोगों ने जो है वो ऐसा फील करना शुरू किया जी कि बस सना मक्की जो है ना वो उसी के अंदर कोविड की जो है ना वो ट्रीटमेंट छुपी हुई है. And I would like to appreciate Dr. Aram Shabir, one of his very important lecture on YouTube. I also have gone through the entire lecture. बताया कि सना के disadvantages क्या हैं, उसके side effects क्या हैं. So pharmacist की patient counseling में और ये जो एक information को filter करने का जो role है, this was very important role. और कई फार्मासिस्टों ने इस रोल को जो है बड़ी अच्छे तरीके से जो है वो अपनी रिस्पांसिबिलिटी डिस्चार्ज की कि लोगों को कन्विंस किया कि क्या इन्फॉर्मेशन दुरुस्त है और क्या इन्फॉर्मेशन दुरुस्त नहीं है. क्योंकि जब पैनिक होती है, ज़ाहिर है वी विटनेस पैनिक सिचुएशन इन दिस कोविड-19. तो पैनिक में फिर जो इन्फॉर्मेशन आ रही होती है लोग ब्लाइंडली जो है उसको फॉलो कर रहे होते हैं। तो फार्मासिस्ट का जो ये एजुकेशन का जो रोल है, ये जो गाइडेंस का रोल है, ये दिस वाज वेरी इंपॉर्टेंट एंड मेजॉरिटी ऑफ फार्मासिस्ट हैव प्लेड दिस रोल very excellently. Then in hospital pharmacist is also to carry out the grouping of medications, preparation of emergency trays, ताकि ये ना हो कि इमरजेंसी सिचुएशन में नर्स जो है वो वार्ड से बार बार आ रही है और आपसे एक एक चीज़ मांग रही है, क्योंकि जनरली एक ट्रे के अंदर जो है उससे रिलेटेड मेडिसिन को ग्रुपिंग करना, उसको उसके अंदर प्लेस करना, ताकि ह्यूमन रिसोर्सेज को भी जो है उसकी वेस्टेज को अवॉइड किया जा सके, टाइम को जो है वो इफेक्टिवली यूटिलाइज किया जा सके। तो हॉस्पिटल फार्मासिस्ट का इसमें भी बड़ा इंपॉर्टेंट रोल था। फिर कुछ हमारे हॉस्पिटल्स जिनमें क्लिनिकल रोल है फार्मासिस्ट का, रिव्यू ऑफ अप्रोप्रिएटनेस ऑफ द प्रिस्क्रिप्शन ऑर्डर्स। ज़रूरी नहीं है कि एक प्रिस्क्रिप्शन ऑर्डर आ जाए तो डॉक्टर ने जो कुछ भी लिख दिया वो बिल्कुल दुरुस्त है, बल्कि हमारे फार्मासिस्ट उसको रिव्यू भी करते रहे। जहाँ पे हमारे यहाँ क्लिनिकल फार्मासिस्ट मौजूद हैं, पर्टिकुलरली कुछ प्राइवेट सेक्टर में, तो वो उन ऑर्डर्स को रिव्यू भी करते रहे और उसमें जहाँ जहाँ जो है वो चेंजेस रिक्वायर्ड थी, जहाँ पे इम्प्रूवमेंट रिक्वायर्ड थी, जहाँ पे कोई ड्रग इंटरेक्शंस का इशू था या वेट के हवाले से उनकी डोजेज दुरुस्त नहीं थी, तो फार्मासिस्ट ने ये रोल भी जो है इस कोविड-19 में प्ले किया है। Then in some of our hospitals, the pharmacists have also conducted the training of the healthcare professionals regarding the use of specialized drugs in COVID-19, कि जी कहाँ पे कौन सी ड्रग यूज होनी है और कौन सी नहीं है। We all know, unfortunately, that the prescriber in Pakistan is greatly influenced by the pharma industry, which leads to irrational prescribing. सो एक्टेमरा को कहाँ यूज़ होना चाहिए, कहाँ यूज़ नहीं होना चाहिए, रेमडेसिविर को कहाँ पे यूज़ होना चाहिए, कहाँ पे यूज़ नहीं होना चाहिए, हमारे फार्मासिस्ट जो क्लिनिकल साइड पे काम कर रहे हैं उन्होंने इसमें भी बड़ा इफेक्टिव और इम्पॉर्टेंट रोल प्ले किया है और उसको फर्दर वो ऐसा रोल प्ले करना है फ्यूचर में भी। द सेकंड मोस्ट इम्पॉर्टेंट एरिया इन पाकिस्तान, ऑल्दो इतना डेवलप नहीं है, एक नया कंसेप्ट है कम्युनिटी फार्मासिस्ट का। पाकिस्तान में बिल्कुल एक फैक्ट है, इसको मेरे ख्याल में एडमिट करने में कोई आर नहीं है कि हमारी मेजॉरिटी रिटेल सेटअप्स, हमारी मेजॉरिटी फार्मेसीज आर नॉट एक्चुअली मैन्ड विद अ फार्मासिस्ट, व्हिच इज वन ऑफ द लीगल रिक्वायरमेंट। बट अल्हम्दुलिल्लाह आई कैन स्पीक विद प्राइड दैट इन इस्लामाबाद, अल्हम्दुलिल्लाह, एवरी फार्मेसी is actually physically manned by a pharmacist. A pharmacist is present on each and every pharmacy in Islamabad. And ये भी फैक्ट है कि कुछ लोगों ने कोविड की आड़ में लंबी छुट्टी भी ले ली, बट मेजॉरिटी ऑफ फार्मासिस्ट रिमेन प्रेजेंट ऑन फार्मेसीज ड्यूरिंग दिस पेंडेमिक इन इस्लामाबाद एंड दे हैव प्लेड अ वेरी ट्रेमेंडस रोल. आई रियली अप्रिशिएट द रोल प्लेड बाय द कम्युनिटी फार्मासिस्ट इन इस्लामाबाद. फर्स्ट दे वर रिक्वायर्ड कि अपने नॉलेज को आप इतना स्ट्रेंथन करें कि आप कोविड से रिलेटेड जितने भी मामलात हैं वो कम्युनिटी फार्मासिस्ट को पता होने चाहिए। सेफ्टी गाइडलाइंस क्या हैं, सेफ्टी प्रोटोकॉल्स क्या हैं, कोविड क्या है, उसमें क्या ट्रीटमेंट पॉसिबल है, ट्रीटमेंट तो नहीं, मैनेजमेंट क्या पॉसिबल है, सारी चीज़ें वी रिक्वेस्टेड द फार्मासिस्ट के अपने नॉलेज को कोविड के ऊपर जो है वो आप थोड़ा सा पॉलिश करें. देन वी रिक्वेस्टेड द फार्मासिस्ट कि जी आप पोस्टर्स वहाँ पे डिस्प्ले करें जिसके ऊपर कोविड रिलेटेड इंफॉर्मेशन, सेफ्टी गाइडलाइंस और ये सारी चीज़ें हों. And on many pharmacies in Islamabad, such posters were displayed ताकि जो customers, consumers वहाँ पे आ रहे हैं वो उन posters को पढ़ें ताकि उनके knowledge में भी इजाफा हो, उनको भी पता चले कि हर घर में कोई ना कोई कोविड रिलेटेड पेशेंट जो है ज़ाहिर है सस्पेक्टेड और कंफर्म मौजूद है, तो उसको कैसे मैनेज करना है, आइसोलेशन कैसे करनी है, उसकी खाना अगर उसको देना है एक आइसोलेटेड पेशेंट को तो कैसे देना है, डील कैसे उसको करना है, किन कंडीशंस में हॉस्पिटल में लेके जाना है, कैसे आपने उसको आइसोलेशन घर पे ही मेंटेन करनी है, ऑक्सीजन सेचुरेशन आपने कैसे चेक करनी है. सो ये सारी चीज़ें फार्मासिस्टों को हमने कहा कि आप अपने आप को अपने नॉलेज को इम्प्रूव करते हुए लोगों को जो है वो आप काउंसलिंग करें. एंड दे हैव रियली डन इट इन इस्लामाबाद अल्हम्दुलिल्लाह. और ज़ाहिर इस्लामाबाद के अलावा भी जिन शहरों में फार्मासिस्ट मेजर सिटीज़ में ज़ाहिर है बहुत सारी फार्मेसीज हैं, चेन फार्मेसीज हैं, वहाँ पे फार्मासिस्ट मौजूद हैं एंड दे हैव परफॉर्म दिस रोल वेरी इफेक्टिवली. देन प्रोमोटिंग दी हेल्दी ईटिंग. ठीक है, फार्मासिस्ट फूड पे एडवाइस कर सकते हैं कि आपको न्यूट्रिशन और फूड कैसा लेना है कोविड में ताकि जिससे आपकी इम्यूनिटी बेहतर हो, बिकॉज इम्यूनिटी का बेहतर होना कोविड में इज़ अ वेरी इंपॉर्टेंट फैक्टर, क्योंकि इम्यूनिटी बेहतर होगी तो ज़ाहिर आप इफेक्टिवली उसको जो है वो फेस कर सकेंगे. देन प्रिस्क्रिप्शन, नॉन प्रिस्क्रिप्शन OTC ड्रग्स कौन सी यूज़ करनी है, बुखार है पेनाडोल यूज़ करनी है या इसके अलावा कौन सी OTC ड्रग्स आपने यूज़ करनी है, ये भी जो है वो कम्युनिटी फार्मासिस्ट जो हैं वो पेशेंट्स को गाइड करते रहे हैं और करते रहेंगे. फिर like advising the customers to use moisturizing creams, क्योंकि बार बार आप अगर हैंड वॉशिंग की तलकीन करते हैं, सैनिटाइजर्स लोग बहुत एक्सेसिव यूज़ करते रहें, ज़ाहिर उससे ड्राइनेस आ जाती है तो आपको मॉइस्चराइजर्स यूज़ करने हैं. इसके अलावा इम्पॉर्टेंट ये है कि कोविड में ज़ाहिर है स्ट्रेस की सिचुएशन, और स्पेशली वो पेशेंट्स जो आइसोलेशन में रहे हैं, एक बहुत ज़्यादा स्ट्रेस की कंडीशन जो है वो रही है उसमें, तो उनको एडवाइस प्रोवाइड करना कि उनकी जनरल वेल बीइंग को कैसे जो है वो इम्प्रूव किया जा सकता है। फिर इम्पॉर्टेंट थिंग इज़ दैट पेशेंट को गाइड किया जाए ताकि जो इररेलेवेंट इंफॉर्मेशन थ्रू सोशल मीडिया आ रही है उसमें से क्या चीज़ें दुरुस्त हैं, किन गाइडलाइंस को आपने फॉलो करना है, WHO गाइडलाइंस हैं, CDC की गाइडलाइंस हैं, हमारी मिनिस्ट्री की गाइडलाइंस हैं, और कौन सी इंफॉर्मेशन जो है वो रिलायबल नहीं है, ये भी फार्मासिस्ट ने जो है वो पेशेंट को, कंज्यूमर को, कस्टमर को बताया और बता रहे हैं। Another very important area for community pharmacist was, जाहिर है कोविड की सिचुएशन में पेशेंट्स हैं, लोगों का घर से निकलना एडवाइजेबल भी नहीं था, लोग निकलते भी नहीं थे। सो हाउ टू प्रोवाइड मेडिसिन टू द पेशेंट एट देयर होम, टेलीमेडिसिन और द ट्रांसफर ऑफ प्रिस्क्रिप्शन टेक्नोलॉजी, इसके ऊपर हमने कोशिश की, और इस्लामाबाद में हमने फिर 2 फार्मेसीज को जो है वो इसके ऊपर तैयार किया कि जो ऑनलाइन डिलीवरी या घरों तक जो है वो इस किस्म की सर्विस जो है प्रोवाइड कर सकें, ताकि लोगों को अननेसेसरी फार्मेसीज को विजिट ना करना पड़े, आप गैदरिंग को मिनिमाइज कर सकें, आप लोगों के इंटरेक्शन को मिनिमाइज कर सकें, लोगों को घर तक हमने इंश्योर किया कि मेडिसिन जो है वो फार्मेसीज से जो है वो प्रोवाइड की जा सकें। इसके अलावा भी ट्राई सर्विसेज हैं, ये तो कम्युनिटी फार्मासिस्ट का रोल प्रैक्टिकली वी हैव विटनेस्ड इन इस्लामाबाद एंड इन अदर सिटीज एज वेल, वो मैंने आपसे डिस्कस किया। नाउ द फार्मासिस्ट का जो रोल है एज ए रेगुलेटर, सिंस इन पाकिस्तान the drug regulators are basically the pharmacists, the drug inspectors, the people working in DREP, all are pharmacists. So as a regulator, what was the role of the pharmacist in Pakistan in this pandemic? Number one, monitoring the availability of COVID-related drugs and PPEs. This was a very crucial responsibility जो drug regulators के ऊपर रही है, और still जो है वो we are performing, me also as a drug regulator, regularly जो है वो हमने जो है वो मार्केट सर्वे जो है वो डेली बेसिस पे हमने रखा कि जी COVID-19 की जो रिलेटेड आइटम्स हैं उनकी शॉर्टेज ना हो। आल्दो की शॉर्टेज हुई है, इसमें कोई शक नहीं है, मास्क शॉर्ट हुए, सैनिटाइजर्स शॉर्ट हुए, लेकिन आई रिमेंबर इन द फर्स्ट वीक ऑफ मार्च इस्लामाबाद में मास्क नाम की चीज़ ख़त्म हो गई थी, क्योंकि लोगों ने, पहला केस इस्लामाबाद में 4 मार्च को रिपोर्ट हुआ, और 4 मार्च की शाम को जो है वो हर एक ने ये समझा कि मास्क पहनने से शायद कोविड ख़त्म हो जाता है, तो मास्क बिल्कुल जो है वो इस्लामाबाद से ख़त्म हो गए। So we immediately identified the potential manufacturers of masks, उनको कन्विंस किया, उनकी प्रोडक्शन जो है वो स्टार्ट करवाई, फैसिलिटेट किया, और इंश्योर किया कि एक रेगुलर सप्लाई जो है वो इस्लामाबाद के अंदर जो है इसको इंश्योर किया जा सके। इसी तरह बाकी शहरों में भी जो ड्रग रेगुलेटर्स हैं उन्होंने सिमिलरली इस चीज़ को मॉनिटर भी किया और इन चीज़ों की सप्लाईज को इंश्योर किया, और ये फंक्शन हम आज तक जो है वो परफॉर्म कर रहे हैं। अभी भी आई हैव बिफोर मी द टुडेज रिपोर्ट कि जी इस्लामाबाद में फॉर एग्जांपल आज जो है वो एक्टिमरा इंजेक्शन 119 जो है अवेलेबल है इस्लामाबाद में, रेमडेसिविर इंजेक्शन इस वक्त जो है वो 470 इस्लामाबाद में अवेलेबल हैं, डेक्सामेथासोन इंजेक्शन 35,000 आज इस्लामाबाद में अवेलेबल हैं। सो वी आर रेगुलरली मॉनिटरिंग द अवेलेबिलिटी ऑफ दीज आइटम्स, ताकि कोई शॉर्टेज जो है वो सिचुएशन डेवलप ना हो और पेशेंट्स को जो है वो इनकन्वीनियंस ना हो। सेकेंडली फिर हमने ये भी इंश्योर किया कि ड्रग्स की जो इम्पोर्टेंट ड्रग्स हैं इसमें, जैसे पहले शुरू में एक्टिमरा की सिचुएशन रही, उससे पहले HCQ की बात रही, अब रेमडेसिविर है, तो अगर इसको इशू भी होना है, डिस्पेंस होना है, तो उसके लिए SOP क्या होगी, वो हमने जो है वो इसमें जो है वो इन्फोर्स करवाई। लाइक देयर शुड बी अ प्रिस्क्रिप्शन फ्रॉम द हॉस्पिटल, देयर शुड बी अ कोविड पॉजिटिव रिपोर्ट फ्रॉम द पेशेंट, देयर शुड बी अ कॉपी ऑफ CNIC ऑफ द पेशेंट, ताकि कोई मिस यूज इंजेक्शंस का ना हो, क्योंकि आपको भी पता है, हमें भी बहुत सारी रिपोर्ट्स आई जी एक्टिमरा का ये हो गया है, वो हो गया, ब्लैक मार्केटिंग हो रही है, कहीं बाहर निकल के पिलफेज हो रही है। तो इस चीज़ को इंश्योर करने के लिए हमने रेगुलरली उन पॉइंट्स का ऑडिट भी किया। स्टिल वी आर कंडक्टिंग द ऑडिट ऑफ दोज रिटेल पॉइंट्स जहाँ से ये मिल रहा है, और ये SOP हम इन्फोर्स करवा रहे हैं ताकि कहीं पे भी मिस यूज ना हो, या मिस यूज की जो अपॉर्चुनिटी है उसको जितना मिनिमाइज कर सकते हैं उसको हम मिनिमाइज हमने किया है और कर रहे हैं। इसके अलावा फिर लाइक ड्रैप में जो रेगुलेटर्स बैठे हुए हैं, जो फार्मासिस्ट बैठे हुए हैं, उन्होंने अपना रोल परफॉर्म किया कि फैसिलिटेट किया जा सके मैन्युफैक्चरर को जो इससे रिलेटेड हैं। फॉर एग्जांपल जो PPEs बना रहे हैं, आई एम विटनेस वी अटेंड सो मेनी मीटिंग्स इन द मंथ ऑफ फरवरी। अभी पाकिस्तान में कोविड का केस नहीं आया था, लेकिन PPEs के जो मैन्युफैक्चरर्स थे उनकी ड्रैप में मीटिंग हुई, CEO साहब ने खुद शेयर की, और हमने हर एक के प्रॉब्लम सीईओ साहब ने सुने कि किसका क्या प्रॉब्लम है, कि क्यों वो मैन्युफैक्चर नहीं कर रहे, अगर उनकी कैपेसिटी अगर फॉर एग्जांपल 10,000 है तो 5,000 पे क्यों है, तो उनको फैसिलिटेट किया ताकि इन चीज़ों की प्रोडक्शन को इन्हांस किया जा सके और इनकी अवेलेबिलिटी को पाकिस्तान में इंश्योर किया जा सके। फिर एक्सपोर्ट पे पाबंदी लगाई गई ड्रैप की तरफ से, दैट वाज आल्सो वन ऑफ द इंपॉर्टेंट स्टेप, ताकि पीपीईज की एक्सपोर्ट को जो है वो रोका जा सके और पाकिस्तान में अवेलेबिलिटी को इंश्योर किया जा सके। रजिस्ट्रेशन प्रोसेस को फैसिलिटेट किया गया, जैसे रेमडेसिविर के केस आए तो अर्जेंट उनकी जो है वो विद इन फ्यू डेज जो है वो रजिस्ट्रेशन प्रोसेस कंप्लीट किया गया और मैन्युफैक्चरर्स को फैसिलिटेट किया गया कि जितना जल्दी पॉसिबल हो दे कैन इंश्योर द सप्लाईज इन द मार्केट। और मेरे ख्याल में रजिस्ट्रेशन के कुछ वीक्स के अंदर ही जो है वो रेमडेसिविर पाकिस्तान में काफ़ी सारे मैन्युफैक्चरर्स की तरफ से अवेलेबल हो गया। फिर इम्पोर्ट के अगर कोई केसेस जो हैं वो रूटीन में होते थे, रॉ मटेरियल के इम्पोर्ट है तो उसको फैसिलिटेट किया गया ताकि रॉ मटेरियल की क्विक इम्पोर्ट को फैसिलिटेट किया जा सके और मैन्युफैक्चरर्स को कोई प्रॉब्लम ना हो कि वो मैन्युफैक्चरिंग उनकी जो है वो हिंडर ना हो और अवेलेबिलिटी को इंश्योर किया जा सके। सो दिस रोल एज अ फार्मासिस्ट हु इज रेगुलेटर, उन्होंने ये रोल जो है परफॉर्म किया इस पेंडेमिक के अंदर और काफ़ी जो है फैसिलिटेट किया। इंडस्ट्रियल फार्मासिस्ट, पाकिस्तान में मेजॉरिटी फार्मासिस्ट आर एम्प्लॉयड इन इंडस्ट्री। I think the total number of pharmacists in Pakistan is around 35,000. तो 35,000 में से जो majority pharmacist है, they are basically serving in industry. इंडस्ट्रियल फार्मासिस्ट की सर्विसेज को यहाँ पे हाईलाइट ना करना बड़ी ज्यादती होगी। जाहिर है अवेलेबिलिटी तब इंश्योर होगी मार्केट में कि ये चीज़ें मैन्युफैक्चर होंगी। एंड हु इज रिस्पांसिबल फॉर मैन्युफैक्चरिंग? इट इज़ द फार्मासिस्ट हु इज सर्विंग इन इंडस्ट्री। ही इज रिस्पांसिबल फॉर कैरिंग आउट द मैन्युफैक्चरिंग ऑफ ऑल दीज आइटम्स। ये हमारे उन फार्मासिस्टों का रोल है जो इंडस्ट्री में काम कर रहे हैं कि उन्होंने टाइमली इन चीज़ों को मैन्युफैक्चरिंग किया, क्वालिटी प्रोडक्ट्स मैन्युफैक्चर किए और अवेलेबिलिटी को इंश्योर किया ताकि हम पेशेंट अपनी को जो है वो फैसिलिटेट कर सकें। इसके अलावा फार्मासिस्ट का जो रोल इस्लामाबाद के हद तक मैं आपसे शेयर कर सकूं, इस्लामाबाद हैज़ डेवलप्ड वन ऑफ द एक्सीलेंट TTQ सेंटर, सर्वेलेंस सेंटर। TTQ मीन्स ट्रेस, टेस्ट एंड क्वारंटाइन का जो मैकेनिज्म है वो इस्लामाबाद में वन ऑफ द एग्जेम्पलरी, और ये मेरे कहने की बात नहीं है, this was appreciated by National Command Center, this was appreciated by the Ministry of Health, and alhamdulillah, being a pharmacist, I was one of the very important team member of this TTQ cell, and I also remained the leader of the rapid response teams in Islamabad. जो rapid response teams patient तक जाना, उनको टेस्ट करना, उनको फिर क्वारंटाइन करना है, उनको हॉस्पिटल तक शिफ्ट करना है, हॉस्पिटल से वापस घर तक शिफ्ट करना है, this all was being performed by that rapid response teams. And those rapid response teams in Islamabad were being looked after by a pharmacist. Then again in Islamabad, alhamdulillah, very recently we have developed Infection Prevention and Control Committee, the very first committee in Pakistan जो Islamabad में established हुई है, and I being coordinator of this committee, we have 5 or 6 pharmacists in this Infection Prevention Control Committee. एक मीटिंग अभी रिसेंटली हमारी जो है वो हो चुकी है और फर्दर इस पे हम जो है वर्किंग कर रहे हैं। एंड द फार्मासिस्ट हु आर मेंबर ऑफ दिस कमेटी आर रियली डिस्चार्जिंग देयर रिस्पांसिबिलिटीज वेरी इफेक्टिवली, वेरी रिस्पांसिबली, और बड़ा अच्छा रोल जो है वो प्ले कर रहे हैं। हैविंग सेड ऑल दिस, आई थिंक स्टिल द रोल ऑफ फार्मासिस्ट नीड्स फर्दर एक्सपेंशन, further elaboration in Pakistan. They are capable of doing so many good things in Pakistan. मेरे ख्याल में with the passage of time further role elaborate भी होगा, expand भी होगा, and the health managers, the policy makers are really realizing the role of pharmacist, और आहिस्ता आहिस्ता इससे भी further जो है वो हमारा role extend होगा in future. So thank you very much everybody.
जी, किसी का कोई क्वेश्चन है? अगर कोई पूछना चाहे तो, डियर स्टूडेंट्स एंड द कलीग, इफ एनीबडी आस्क सम क्वेश्चन, क्योंकि मैं शबीर साहब से सवाल मेरे ज़हन में, a very informative talk, definitely all of the speakers are very competent and they are considered as authority in their discipline to say about something about the role of pharmacist. Shabir sir, I want to ask very briefly and as well as very informatively, you described the role of pharmacists, you highlighted in different types of the roles that pharmacists. But do you think that pharmacists should perform that they could not achieve during this pandemic period. The pharmacist can perform this height of the role, but they could not get that. What do you think?
Definitely, Dr. Saiba, जैसे मैंने पहले भी कहा कि they are capable of doing so many other good things. But in Pakistan's healthcare system, the role of pharmacist is restricted, actually. मेरे ख्याल में इस्लामाबाद के अंदर मैं दो चीज़ों के ऊपर जा रहा था. नंबर वन, इंक्लूजन ऑफ फार्मासिस्ट इन सर्वेलेंस एक्टिविटीज़, और मेरा जो है वो पूरा प्लान तैयार था, बट अनफॉर्चुनेटली आई माई सेल्फ गॉट विक्टिम ऑफ द कोविड एंड आई लैंडेड इन ICU इन हॉस्पिटल. सो वो प्लान मैं मटेरियलाइज नहीं कर सका क्योंकि मैं. सेकेंडली, लाइक USA एंड UK, फार्मेसीज को यहाँ पे हम प्लान कर रहे थे कि टेस्टिंग फैसिलिटी के तौर पे जो है वो यूटिलाइज किया जा सके, कि टेस्टिंग का एक बहुत बड़ा इशू था. लोगों का घर घर जाके टेस्ट करना, अब घर के साथ एक फार्मेसी है, तो हमारा ये पूरी तरह मैं प्लान कर चुका था कि गवर्नमेंट की परमिशन से जो है वो फार्मेसीज के ऊपर जो है वो कोविड की टेस्टिंग को जो है वो हम यहाँ पे एक पायलट प्रोजेक्ट के तौर पे शुरू करें. बट अगेन अनफॉर्चुनेटली मेरे जाने के साथ चूंकि फिर मुझे कोविड हो गया, मैं चला गया, वो चीज़ें अधूरी रह गई. लेकिन स्टिल क्लिनिकल रोल फार्मासिस्ट का बहुत बेहतर हो सकता है पाकिस्तान में, जैसे और बहुत सारी कंट्रीज में है जहाँ पे उतना इफेक्टिव नहीं है, उतना प्रोमिनेंट नहीं है. मैडम, कम्युनिटी फार्मासिस्ट के ऊपर मैंने पहले भी बताया और आपको भी पता है, हम सब इस चीज़ के विटनेस हैं कि अराउंड 90,000 सेल रिटेल आउटलेट्स हैं पाकिस्तान में, 90,000. लेकिन उन 90,000 में से कितने के ऊपर फार्मासिस्ट एक्चुअली मौजूद है? शायद बहुत ना होने के बराबर. तो वो एक इंपॉर्टेंट रोल है कम्युनिटी फार्मासिस्ट का, जो हो सकता है पाकिस्तान में लेकिन अभी नहीं है. उसको हमने फर्दर जो है वो सब ने मिल के जो है वो इंश्योर करना है कि कम्युनिटी फार्मासिस्ट के तौर पे फर्दर जो है हम अपने रोल को जो है वो फर्दर एनहांस कर सकें. क्लिनिकल साइड पे हमारा रोल बहुत रिस्ट्रिक्टेड है, इसको फर्दर एनहांस करने की जरूरत है. फार्मासिस्ट हमारे कैपेबल हैं, लेकिन हमारा हेल्थ केयर सिस्टम जो है वो अभी शायद उनकी जो रोल है उसको रिकग्नाइज करने का उस लेवल तक अभी जो है वो कैपेबल नहीं है. ये चीज़ें इंप्रूव होने की जरूरत है. डेफिनेटली फार्मासिस्ट को बहुत ज़्यादा यूटिलाइज किया जा सकता है. ये एक बहुत इंपॉर्टेंट हेल्थ केयर प्रोफेशनल्स हैं जिनको अभी हमने अंडर यूटिलाइज किया हुआ है.
Thank you very much, Suresh sir. Thank you.
Thank you, ma'am.
Thank you very much, sir. You have always been very kind. It was quite an informative talk. जैसे कि हम जानते हैं कि आप फ्रंट लाइन पे थे और फ्रंट लाइन पे होते हुए आप खुद भी COVID-19 का शिकार हुए. हम सबकी दुआएं आपके साथ थी और अभी भी आपके साथ हैं.
बिल्कुल बिल्कुल शबीर साहब, आप बहुत आपने प्ले किया. हम यहाँ सुनते रहते थे कि आपका किरदार बहुत अहम है, बल्कि वहाँ मौजूद ड्राफ्ट में हमारे कोलीग हैं फार्मासिस्ट, उन्होंने बहुत फोर फ्रंट पर आकर काम किया और राउंड द क्लॉक काम किया. ये बात हम सबको पता है कि जो हमारे फार्मासिस्ट इस्लामाबाद में बैठे हैं या पैराफ्री में बैठे हैं, वो चुनाचे बिल्कुल ही अंडर द नोज होते हैं, तो वो तो एट टो होते हैं ऑल द टाइम. तो डेफिनेटली इट इज अप्रिशिएटेबल. थैंक यू.
Thank you very much. So our next speaker is Mr. Kalimullah. He is Pharm D from Bakai University, Karachi, and MPhil Pharmacology from University of Veterinary and Animal Sciences, Lahore. He is currently serving as Chief Pharmacist, National Hospital and Medical Center, DHA, Lahore, and as a Manager Pharmacy Services, Bahria International Hospitals. He has also received certificates of basic and advanced good pharmacy practice from Taipei Veteran General Hospital, Taiwan. Previously, he has also served as consultant pharmacist in Doctors Hospital and Medical Center, Lahore. So I invite Mr. Kalimullah to please join. जी कलीम साहब.
अस्सलाम वालेकुम. आवाज़ आ रही मेरी साहब? Can you hear me? Hello.
जी आपकी आवाज आ रही है.
Bismillahirrahmanirrahim. First of all, I would like to thank you, Professor Dr. Humaira and Dr. Arham, for inviting me and giving me this opportunity to share my views with you people. मुझे डिसेबल किया हुआ है, मैं अपनी PPT शेयर करना चाह रहा हूँ, प्लीज उसे जरा इनेबल कर.
अहमद साहब प्लीज एनेबल कीजिएगा, डॉक्टर कलीमुल्लाह साहब का स्क्रीन शेयरिंग एनेबल कीजिएगा प्लीज, और इनकी साउंड भी थोड़ी सी अप कर दीजिए प्लीज।
I would like to start from good news. Just received now the information, up-to-date information about the COVID patients in Lahore, especially in the private sector hospitals. Among the biggest setup in Lahore, especially the National Hospital and the two hospitals of the Bahria International and Amir Latif Hospital, Doctor Hospital and the Farooq Hospital as well. We have the 0 patient in the National Hospital right now and 2 patient in the Doctor Hospital and 7 patient in the Farooq Hospital, 4 patient in the Hamid Latif Hospital and the 0 patient in the both of the hospitals of the Bahria International. Right now we have the only 10 to 11 patients in all the private sector hospitals of Lahore. And the status is almost similar in the public sector hospitals as well. As we are in Pakistan and especially the Lahore, because you people know so that the more number of patients were in Lahore and now the phase is was declining the patients. We should be knowing about the background of this virus, as there were the 2 types. One that the Middle East respiratory syndrome and the other one is the SARS. For the SARS, severe acute respiratory syndrome, it was also due to the coronavirus, and the first patient was seen in February 2003, and the 8096 patients globally were seen, and the number of deaths as per data, that was the 9.6%. That were quite high rate. And the later on in the Middle East respiratory syndrome, the first patient was seen in the Saudi Arabia in 2012, and the fatality rate was mortality rate was 34.4%. That was also quite high. Now you can see the status globally. Still, many countries are facing the more number of patients per day as India, Mexico, but it's good for the Pakistan that the last 24 hours we have only up to 500 positive cases and the 15 deaths totally. What interventions, what were the strategies that we adopted and now moving towards the declining phase, lockdown and the shelter in place and the social measures, quarantine, isolation, social distancing, masking, hand hygiene, and the TTT program as earlier discussed by the Sardar Shabir. And the therapeutic drugs were strategies were goes on changing day to day. Every day we receive the new guidelines and being the pharmacist and as we have the largest number, second largest team of pharmacists in National Hospital in the private sector, almost 17 pharmacists are working there. We really collaborating on the daily basis with our consultants, especially relevant to the dosing and the interactions of the drugs, and so many times we intervene and suggested the doctors that at this moment Actemra, tocilizumab or the remdesivir is not needed, and they ultimately convinced, and the patient recovered without the tocilizumab. And as you people know that almost a month uh, ago, we were facing the severe crisis about the tocilizumab and the remdesivir. And every patient wants the tocilizumab, just like the toffee. And especially being a pharmacist and covering the three main hospitals of the Lahore, uh, I was under pressure where to manage these drugs, because in market there was a severe shortage. Quarantine and isolation, everybody saying they be quarantine or the isolate themselves or the something like that. I think कि अगर किसी पेशेंट को कोरोना हो गया तो हमने कहा कि ये कोई शायद जूझ मजूझ है, ऐसी बात नहीं है. We should know about being a pharmacist. We should have the sufficient knowledge. What is the meaning of the isolation? What is the meaning for the quarantine? I myself suffered from the corona and only got the 2 leaves from hospitals, and I continued to work during my corona period. What I did, I just wore the double mask, nothing, anything else, and I just try to save other people's from me. I just maintain the social distancing and work during my COVID period. Because of the pressure, I can't go for the leave because the essential medicine and the PPs and the collaboration with the consultant was deemly needed at that moment rather than my health. And what factors that needed to be done, as we are on the declining phase in Pakistan, and inshallah ta'ala, after a few days, we will be hearing news that we have the no patient, no positive case in past 24 hours, inshallah. We have to build up our capacity of the healthcare system, as almost 2 months ago in the June or the mid of the June, we do not have the single bed anywhere in Lahore to accommodate the patients, and we receive calls whole night, and the people were saying that just please arrange the one bed. If we would be if we if we can manage the one patient, we can save the one life, but we do not have the capacity to accommodate even a single patient, and especially those patients who need the oxygenation, who need the ventilator support. Uh, that were the main problems at that moment. And the second thing, we need to extend our testing capacity. That was very low, remain low. Even when we having the peak, we have the very low testing capacity, and it is needed to increase. Even I know so many patients who gave the test, who gave the sample in the public sector and uh, receive the reports after 10 days. What to do uh, if the patient is enough sensible and knows about the symptoms and can understand either to be quarantined or isolate himself, he can manage. Otherwise, as you people know, the literacy rate of our country, uh, how the patient can isolate himself as he didn't know about the test report, either he is a positive or the negative. And the other question is, what kind of test to be done, either the PCR or the serological testing. There are many pros and cons behind this, but still the PCR is recommended to uh, and considered as a confirmatory test, either the positive or the negative. But keeping in mind that the false negative rate and the false positive rate, but more the false negative. Many times we receive the patient whose COVID was not confirmed, and we go for the testing again and again because the symptoms are quite similar. My own patient, uh, I saw one of my relatives, we kept them in the emergency for 3 days because because the symptoms were quite similar. X-ray were having the white patches, but the patient report was the negative. Ultimately, we received the positive on the third day. That was also a problem. But the serological testing, we cannot rely on the antibodies testing for the treatment because antibodies may be positive, may not be positive, depending upon the uh, period of the starting of the symptoms and other things. If you can say the PCR is positive and the IgM and IgG is negative, it's quite possible because it is just a beginning of the infection. And many times the PCR is negative, but the IgM and the IgG remains positive. That is it was seen and recommended by our hospital guidelines. According to the guidelines, serological testing must be done uh, after at least 15 to 20 days. Then you may get the positive results. Tracking of the new cases, as I earlier described, that we remained on the low capacity for the testing in the public sector and as well as in the private sector. Also, our capacity was not up to the mark, and especially the technical personnel who were taking the samples really ill experienced because 35% test result depends upon the technique of taking the samples. Identifying the previously infected patients and isolate them and educate them that you have to keep yourself uh, out of the other people, out of the range from the other people, and you have to save the other people's. And gaining the intelligence on the evaluation of the epidemic, and it is also very much important as estimated that over 50 to 60% of the population needs to be immune to the virus to help it spread. And ultimately, I think many of the Lahore population has got infected and remain asymptomatic, and no, we have the herd immunity. According to the surveillance system, we have the three types of the surveillance. Sentinel surveillance and the syndromic surveillance. What is the sentinel surveillance? According to the sentinel surveillance, we rely on the samples that were in the previously, when we having the peak, we rely on the sentinel surveillance. We do more and more tests to make some conclusion. But now, as we are in the declining phase, we have to rely on the syndromic surveillance system. We have to apply the statics to conclude, make some conclusion for the better safety. Wastewater surveillance, still there is no sufficient data about the wastewater, especially the hospital wastewater, which is definitely containing this virus. Either it may spread in the community or not, but we have a close eye on it, and we have to search more and more. And what are the goals to be done? especially tracing the people who are positive and isolating them and educating them how to take care of themselves. And the second one is we can also make some app as previously discussed on the social media, that the app may be uh, installed somewhere that the person who got the positive and to evaluate its social context, especially the places where he visited, and either maintain the social distancing or not, and may spread infection to the others or not. And the risk identified that will be contacted and given advice of what to do, especially the patient becomes panic when they saw their report is positive, and uh, the environment that we create, especially I saw many of the cases in which the relatives, the attendant do not attend their patient due to the panic. And we need to educate the people. कोरोना कोई अछूत नहीं है, हमें अपने पेशेंट की केयर करनी है और उसे इस बात का एहसास नहीं होने देना कि वो शायद कोई उसको ऐसी जो बीमारी लग गई है कि वो क्योर नहीं हो सकती है, ठीक है. बट keeping in view all kind of measures, especially the masking, social distancing, and all relevant things. What we used, so many countries used so many drugs on the hit and trial basis. What we used in Pakistan, especially these hospitals, first we were using the hydroxychloroquine, but being a pharmacist, we try to educate our consultants and the layman people that hydroxychloroquine should not be used until unless it is deemed needed. And later on, we also saw some news about the ivermectin, and being a pharmacist, we educate our people that ivermectin is still not recommended by the FDA, and the remdesivir also was recommended only a month or the two ago for treating the COVID patients. And vitamin C was used just like the toffee. To some extent, vitamin C have the role for boosting up the immunity, but still it is questionable that we should use as much quantity of the vitamin C as much more than the daily requirement of the vitamin C. Methylprednisolone also used in the ICU only in the critically ill patients, not in the common project. What is needed to be done to avoid the second phase? At least we need to 2 to 6% test of the total population per day, and we should have the adequate quantities must be available in our hospital, especially the tocilizumab and remdesivir for treating the patients who are in the ICU. There might be a series of the waves, as many scientists are believing that we may have the second peak in the end of the August or the start of the September, and many more, because our weather conditions will be changed in the September. That may we have sneezing or the influenza or any other kind of virus, and having the similar symptoms, but we have the close eye on it, and increase our testing capacity so that we can identify confirmed COVID patients. And we may have the different scenarios in future. Either we have the small peaks continually, and either we have some larger peak and then ultimately goes down. Either we have the trough and the crust wave-like peaks, but we should have the close eye and maintaining the still, although we are in the declining phase, but we should maintain the social distancing and again the hand washing, the same things, and the PPEs, especially the mask. Uh, we have to maintain all these things. I would like to add one thing about the mask because previously discussed by the Sardar Shabir Saab that the masks were remain short in the market. What we did, we just make the mask by the tailor or the uh, somebody imported the machinery and they just make the face covering, not the actual mask. They just make the mask by the non-woven cloth. Actually, I would like to tell you that you must be aware about the surgical mask. What is needed that always when you get mask, always just warn it out and find the melt blown paper. If it is without melt blown paper, it is a useless. That's all about from my side. Thank you so much. If you have any question, you may ask, please.
Thank you very much, Dr. Kalimullah. You participated very well and you gave us much information about the figures that we don't know even before. Somehow, some are very well known to me, but some I don't know. Likewise, all the members. I want to ask a question from you. Don't you think that the manufacturing of mask or manufacturing of sanitizers or disinfectants should be, or other, you can say, dispensing drugs that we can dispense, should be allowed in the hospitals like in our childhood? The syrups were made on the counter by the dispenser and given to the kids or the patients in a clinic of a doctor. I'm talking about the 1980s or 90s when the clinics, these mixtures were given to the patients. This is my first question. Second, every hospital purchased the medicines by the pharmacy. Is there any change happens in the formulary of a hospital in COVID-19? And what is that change?
As for your first question, dispensing should not be allowed in any of the sector where pharmacist is not present, and dispensing of any kind should be under the dedicated area. If you have the dedicated area for the dispensing, you can dispense under the supervision of pharmacist. If you don't have the dedicated area, aseptic area or the non-aseptic but clean area, you can't dispense. Second, sorry, I didn't understand your second question. Can you repeat, please?
I asked, there is any change in the formulary of the hospital during COVID-19? That the formulary, that the drugs which you are being purchased in the previous few years, that some changes happen in the formulary? What are that changes? Addition or deletion of the drugs, or you can say the ADRs, as per looking forward to towards the ADRs, you deleted certain drugs and you added certain drugs.
As such, in the private hospitals, there is no concept of the formulary, and even at the national level, I think so. It was so long, either it was updated or not. According to my information, Children's Hospital may have the proper formulary. Otherwise, the rest of the hospitals don't have. But obviously, day to day we update our information and also convey the consultant about the ADRs and the side effects, especially the tocilizumab and the remdesivir. There was a clear-cut guidelines that these should only be administered in the ICU because the severe respiratory failure may occur by the use of these drugs, especially the tocilizumab. And we have seen many patients in which the saturation abruptly dropped by using the tocilizumab.
Thank you very much.
Thank you very much, Kalimullah sir. It was quite informative talk. हमारी दुआएं आपके भी साथ हैं. आपने भी फ्रंट लाइन पे जैसे आपने बताया कि कोविड-19 सफर किया आपने भी. अल्लाह आपको मजीद सेहत अता फरमाए. So thank you very much. मेरा क्वेश्चन सरदार शब्बीर साहब से है. मेरे दो क्वेश्चंस हैं एक्चुअली सरदार साहब से. पहला क्वेश्चन तो सर ये है कि क्या ये एज्यूम करना ठीक है कि गवर्नमेंट पॉलिसीज हमें प्रैक्टिकली हर्ड इम्यूनिटी की तरफ, पाकिस्तान को हर्ड इम्यूनिटी की तरफ ले गई हैं, या एक्चुअली अनडिक्लेयर्ड तरीके से हम हर्ड इम्यूनिटी में शामिल हो चुके हैं, उस कंसेप्ट में फॉल कर चुके हैं. और दूसरा क्वेश्चन मेरा ये है कि कुछ लोग अभी कह रहे हैं कि शायद एक सेकंड पीक आए, तो आपका डाटा वहां क्या कहता है कमेटी में कि क्या कोई सेकंड पीक आने के चांसेस हैं या इंशाल्लाह डिक्लाइन ही रहेगा? सरदार शबीर साहब प्लीज. अनम्यूट नहीं हो रहे. आवाज नहीं आ रही. नहीं, वो बात कर रहे हैं लेकिन
सर आप अपना माइक अनम्यूट करें पहले प्लीज.
जी डॉक्टर साहब आवाज आ रही है? डॉक्टर साहब कैन यू हियर मी?
जी आ रही है आपकी आवाज. अब
जी आ रही है, आपकी आवाज आ रही है.
अच्छा, पहला क्वेश्चन मैंने कहा जो आपका था ना हर्ड इम्यूनिटी के हवाले से, तो वो बेसिकली क्वेश्चन इज रिलेटेड टू द पॉलिसी ऑफ द गवर्नमेंट, जो आपकी क्वेश्चन है. तो यहाँ पे तो मैं गवर्नमेंट के बिहाफ पे कोई पॉलिसी स्टेटमेंट देने की पोजीशन में नहीं हूँ, ना दे सकता हूँ ना देना चाहता हूँ. लेकिन इफ you ask me as a pharmacist, as a private individual, as a citizen of Pakistan, as a healthcare professional, तो yes, I do agree with you कि बड़े undeclared तरीके से we are moving towards herd immunity वाला जो concept है उसी तरह ही इसके बहुत सारे evidences भी हैं. वो मैं अपनी statement की support में मेरे पास हैं, लेकिन मैं यहाँ आपसे share नहीं कर सकता. Privately आपसे share कर लूँगा, जिससे यही साबित होता है कि हम undeclared तरीके से herd immunity की तरफ जा रहे हैं. Second question डॉक्टर साहब मैं आपका भूल गया हूँ.
सर सेकंड क्वेश्चन ये है कि कुछ लोग ये समझ रहे हैं कि अभी एक सेकंड पीक आएगी.
सेकंड वेव अभी जो हमारी इन्फेक्शन प्रिवेंशन कंट्रोल कमेटी की जो मीटिंग हुई, तो उसमें जो हमारी फोकल पर्सन है, शी इज बेसिकली आईडी कंसल्टेंट एंड शी इज आल्सो द फोकल पर्सन फॉर कोविड-19 जो मिनिस्ट्री की तरफ से. उनका भी एज एन एक्सपर्ट व्यू ये था कि वी शुड गेट रेडी फॉर अ सेकंड वेव व्हिच माइट कम इन कमिंग मंथ्स. तो एक्सपर्ट्स का व्यू यही है कि सेकंड वेव जो है वो पॉसिबल है, जो बाकी इससे जो अदर वायरसेस वायरल डिजीज हैं उनके पैटर्न को देखते हुए उनका व्यू यही है कि सेकंड वेव के लिए हमें तैयारी करनी चाहिए और एक्सपेक्टेड है सेकंड वेव.
शबीर साहब ये बताइए जो सेकंड वेव एक्सपेक्टेड है, ये यूरोप में तो वो लोग कर रहे हैं द कमिंग विंटर, बिफोर कमिंग विंटर दे आर ट्राइंग कि हम कोई वैक्सीन मार्केट कर दें और वो कुछ कर दें. हमारे यहाँ विंटर पीरियड बहुत शॉर्ट होता है, दैट्स अबाउट 2 months। तो मौसम का तो इस पे कोई असर है नहीं। मैं आपसे ये पूछना चाह रही हूँ, क्या हमारा भी वही पीरियड होगा जो यूरोप में और बाकी जगहों पर ये फोर्सी कर रहे हैं कि उससे पहले कर लेना चाहिए?
मैडम, जो प्राइवेटली मेरी डिस्कशन जो एक्सपर्ट से हुई प्राइवेटली, ऑफिशियल फोरम पे नहीं, वो तो कह रहे हैं कि बेसिकली दिसंबर एंड जनवरी या इससे थोड़ा सा शॉर्टर पीरियड में भी सेकंड वेव एक्सपेक्टेड है पाकिस्तान में। तो उसके लिए बेसिकली हमारा एक ओवरऑल एज ए नेशन एक एटीट्यूड है ना कंप्लेसेंट होने का, कि ठीक है जी कोविड ओवर हो गया है, अब अस्पताल खाली हो गए हैं, मरीज थोड़े रह गए हैं, पॉजिटिव केसेस कम आ रहे हैं, सेवेरिटी कम आ गई है। तो एक कंप्लेसेंट एटीट्यूड हमारे अंदर आ रहा है कि अब आप मार्केट में अगर आप देखें, महीना पहले एक सिचुएशन डिफरेंट थी, अब आप मार्केट्स का विजिट करें, गैदरिंग ज्यादा है, मास्क मेरे ख्याल में आपको 100 में से शायद एक बंदे ने नजर आपको आएगा कि पहना हुआ है, सोशल डिस्टेंसिंग हमने खत्म कर दी है। तो हम एक कंप्लेसेंट एटीट्यूड की तरफ जा रहे हैं कि बस ठीक है जी, वी आर ओवर नाउ, कोविड खत्म हो गया। पहली बात है कोविड खत्म नहीं हुआ, स्टिल अभी इन्फेक्शंस हो रहे हैं, ठीक है, कमी आई है, डेफिनेटली आई है, लेकिन स्टिल इन्फेक्शंस हो रहे हैं। और सेकंड वेव एज पर एक्सपर्ट्स, मैं तो कोविड का एक्सपर्ट नहीं हूँ, लेकिन ज़ाहिर है बाय वर्च्यू ऑफ माय असाइनमेंट इंटरेक्शन जरूर रहता है, तो एक्सपर्ट्स का व्यू यही है कि सेकंड वेव के लिए हमें वी शुड गेट रेडी, और हमें जो है ये अपने एटीट्यूड जो हमने डेवलप किया था कुछ एसओपीज फॉलो करने का, उससे हमें पीछे नहीं हटना चाहिए।
अच्छा शबीर साहब, एक तो वो एसओपीज आप हमारे लिए जरूर हमें इरसाल करें, चाहे अरहम को मेल कर दें। हम चाह रहे हैं कि हम हमारी जो कोरोना कमेटी है उसमें भी हम उन एसओपीज को सेकंड वेव के लिए भी तैयार कर लें, ताकि हम अपनी बच्चियों को, अपने असातिज़ा को उससे वेल अवेयर कर सकें। क्योंकि ये वो तबका होता है यूनिवर्सिटी का जो ऑलरेडी वेल अवेयर होगा तो दूसरों को अवेयर करेगा। उनको ट्रेन करना, उनको तैयार करना और उनको सारी चीजों से। एक मुझे बताएं, क्या कट ऑफ लाइन कोई गवर्नमेंट ने बनाई है कि इतने परसेंटेज हमारे पेशेंट्स होंगे, उससे नीचे होंगे तो हम इसको ओपन कर देंगे तमाम इदारों को? या
बेसिकली मेरे ख्याल में 5% इन्फेक्शन रेट जो है वो कट ऑफ लाइन होती है। 5% से अगर लेस आ जाए तो आप एक्टिविटीज रूटीन की शुरू कर सकते हैं। पाकिस्तान उससे नीचे आ गया है सो फार। अभी जो पाकिस्तान में पिछले 1 वीक से जो रिपोर्ट्स आ रही हैं, पाकिस्तान उस कट ऑफ लाइन से नीचे आ गया 5% से, लेकिन स्टिल 100% चीज़ों को ख़त्म कर देना। देखें, एक्टिविटीज़ तो रेज्यूम की जा सकती हैं, अभी गवर्नमेंट ने ये भी डिसाइड कर लिया, स्कूल कॉलेजेस भी इन कमिंग फ्यूचर अगले मंथ से खुल रहे हैं, बट विद ऑब्जर्वेंस ऑफ एसओपीज़। ये नहीं है कि एसओपीज़ जो पर्सनल प्रोटेक्शन की जो एसओपीज़ हैं उनको फॉलो करते हुए ये एक्टिविटीज़ जो हैं वो स्टार्ट की जाएंगी। पूरी दुनिया ने, मेरे ख्याल में यहाँ पे हमारे फार्मासिस्ट मौजूद हैं जो फॉरेन कंट्रीज़ के हैं, दे विल एग्री कि उन्होंने भी अगर ये एक्टिविटीज़ रिज्यूम जिन जिन कंट्रीज़ ने करवाई हैं तो एसओपीज़ को फॉलो किया है। तो अब भी एसओपीज़ हमने फॉलो करनी है। इसका मतलब ये नहीं है कि टोटली मास्क जो है ना वो उसी तरह ही हमने जो है वो यूज़ करना ख़त्म कर देना है, सोशल डिस्टेंसिंग हमने ऑब्जर्व नहीं करनी, हैंड सैनिटेशन जो है वो हमने ख़त्म कर देनी है। ये चीज़ें हमने फॉलो करनी है, लेकिन ऑफ कोर्स व्हाइल ऑब्जर्विंग दोज एसओपीज़ ये एक्टिविटीज़ रूटीन की जो है वो आहिस्ता आहिस्ता रेज्यूम हो रही हैं,
रेज्यूम हो जाएंगे। जी बिल्कुल, एचईसी ने हमें दिए हुए हैं एसओपीज़, और एसओपीज़ एचईसी ने दिए हुए हैं, और लाहौर कॉलेज फॉर वुमेन यूनिवर्सिटी ने भी अपने एसओपीज़ ड्राफ्ट किए हैं, क्योंकि मैं उस कोरोना कमेटी की एक मेंबर भी हूँ। मुझे आपसे भी अगर इन्फेक्शियस कंट्रोल के जो एसओपीज़ आपने बनाए हैं वो भी आप अगर हमें अरसाल कर दें
तो हम उसको I will share with Dr. Aram.
बहुत शुक्रिया सर, बहुत
Thank you, ma'am.
Thank you very much, Sardar Shabir sir.
Thank you, sir.
I am thankful to all the speakers. आप सबने अपना कीमती टाइम स्पेयर किया, और सारे पार्टिसिपेंट्स का भी मैं आई एम वेरी मच थैंकफुल टू ऑल द पार्टिसिपेंट्स टू। मैं खास तौर पर आई एम थैंकफुल टू प्रोफेसर डॉक्टर हुमैरा मजीद खान। शी हैज बीन रियल मोटिवेशन एंड force behind this webinar. So thank you very much, Dr. Humaira, for organizing this webinar for all of us. It was quite informative. I am hopeful that it would be quite informative for all the students who attended this webinar. Thank you very much. आपकी इजाजत से अब हम इंशाल्लाह को खत्म करेंगे। आज जो है इसमें सारे कश्मीर भी हैं, तो जाते जाते इस हवाले से भी एक पैगाम देना चाहेंगे कि हम कश्मीरियों की जिद्दोजहद में उनके साथ हैं, और हमारी दुआ है कि वो जल्द इंशाल्लाह आज़ादी को अचीव करें। अल्लाह ताला हमारा और उनका उन सबका हामी नासिर।
बिल्कुल इस सिलसिले में हम सब आमीन कहते हैं और लब्बैक कहते हैं कि अल्लाह ताला हमारे मुजाहिदीन की, हमारे कश्मीरी बहन और भाइयों की दुआएं और उनकी स्ट्रगल को अपनी बारगाह में कबूल करे और उन्हें भी आज़ादी से सांस लेने का। आप सब का बहुत शुक्रिया इस वेबिनार को अटेंड करने का, टाइम देने का, खास तौर पे स्पीकर्स का जिन्होंने अपना इतना कीमती वक्त हमें दिया, हमारे पार्टिसिपेंट्स का। और उम्मीद है आप सब अपनी खैरियत से अपने घरों में रहें। अल्लाह ताला से दुआ है कि अल्लाह ताला आपकी हिफाजत फरमाए। बहुत शुक्रिया। अल्लाह।